Yes, I understand that every life must end. As we sit alone, I know someday we must go on. Oh, I'm a lucky man to count on both hands the ones I love. Some folks just have one, yeah, others they got none. Stay with me, oh, let's just breathe. Practiced on my sins, never gonna let me win. Under everything, just another human being. Yeah, I don't wanna hurt. There's so much in this world to make me bleed. Stay with me, all I see. Did I say that I need you?
Possibly. I've seen one gentleman brought in about 5 times for public intox or a DUI, and another gentleman, they really wouldn't talk to anybody else, but they'll talk to me because I saw, that was military. They can't, about the one guy can't put down a bottle. One other guy, he just can't stop taking pills. So have problems, we don't like talking about it. We're not so forthcoming. We're emotionally shut off. We don't like. So it's a lot harder for just regular counselors who haven't had any experience whatsoever in this field to try to get us. We feel they don't understand because they haven't been there. They haven't been through what we have experienced. So therefore, how can they help us when they don't even know? And I was seeing the local local counseling service here. That was a nonprofit organization, but they've never dealt with PTSD before. And my addiction actually got worse, and it kept on getting worse. They just didn't know what to do, and then eventually I tried to quit seeing them because it wasn't doing me any good. And I got some help in another route, and finally got a lot better and got a lot of help, and finally worked for me.
Excellent. Turns you into an alcoholic.
Makes it hard on people, and for some to cope, they turn to drugs and alcohol, of course, as a way to cope with the stress. The need for counselors is very prevalent need in the military, particularly because soldiers need to be taught how to deal with those things in more productive ways instead of destructive ways, I believe.
The need is so great, I just can't put it into words. Daily we're dealing with service members either getting discharged dishonorably, having administrative actions against them, domestic violence charges, DUI. Oh man, I have a lot of service members and veterans who have DUI. We've even set up a whole court system. So Oklahoma, if you look at each county in Oklahoma, there are hundreds, if not thousands, of veterans and active service members, reservists, National Guard members in each county. As state director, one of the things is we just do not have the clinician base, so they just don't know how to treat military service personnel, and that is the biggest thing. They don't understand the culture, they don't understand the mentality, they don't even know what the deployment is like for the service member and their family. In their community, then they go get help from a mental health provider who doesn't understand the military or their experience and cannot relate to them in any way, and they feel even isolated even more, and they're less likely to continue with treatment because of their experience. I hear that every day. So I have to keep searching and searching and searching and searching and searching for therapists that are just that know the military and can treat substance abuse, because there's co-occurring issues. They either have PTSD, some type of adjustment disorder, some type of deployment distress along with, or their substance abuse. And so really understanding that and training people and educating clinicians on that is very important, and the need just grows every day.
I think that'd be a tremendous benefit. I think it's a good fit for our department because we prepare a lot of professionals to go into that field, and there's a strong number of military personnel that are returning from the war in need of those type of services, and the indication I get from the professional field is that there's a tremendous shortage of providers. I think we've been a good overseer of funds for these services. We have an excellent track record and have provided similar type of services for other target populations.
I have worked directly with ECU. Dr. Balmer and Dr. Putnam. ECU has the Gold program, the Upward Bound program. They're very friendly to service members. I've had several service members that have been identified on the campus by the staff and the personnel there, and so we've been able to come in and to help out with them, provide consultation and stuff. ECU is just such a military-friendly environment. There are a lot of veterans on the staff there. There are a lot of military people who understand. I've asked for any support from ECU. They have just responded on that, but ECU gets it. They're the only university in the state that really already has a collaborative and systemic model, and they're already working with me at the state level already. It just seems to be a natural integration. And any money given to ECU will be used very frugally, and they will put it into practice. I mean, they will make the rubber hit the road. Service members, tens of thousands of service members, if not hundreds of thousands of family and service members will be possibly affected by this. Just because of the fact that of the scope of the number of service members we have in Oklahoma. But ECU has a lot of access to those, plus the partnerships I've already developed with myself and other community organizations. They already have those partnerships in place. And the southwest part of Oklahoma, or part of the United States, excuse me, does not have any type of training. And we have a deficit. We have these rural areas. ECU would be training a lot of people. People be coming to ECU throughout the United States just to get this type of training. I would love to see $1.5 million go to ECU to develop a center, to have the Center for Excellence, to have a training program, to have a director, to have staff and education, but then also be able to promote this throughout the United States and really have a training center where people can come and participate in this, because it's needed, but it's not being done. And if you really want to touch the lives of hundreds of thousands, if not millions of veterans and their families, service members and their family members, this is the way to do it. This is the way to do it. Because these people being trained are the ones who are going to provide the treatment for substance abuse and will change the family system and stop the cycle of addiction and stop the abuse and stop the potential for suicide, self-harm, and homicide that is associated with substance abuse issues and service.